A mammogram is the standard test for diagnosing breast cancer, but physicians often use ultrasound to take a closer look at areas that may be concerning to radiologists.
In today's Focus for the Cure, News Channel 5's Kelly Dunn shows us a new automated three-dimensional ultrasound that has some advantages over the traditional 2D.
Good morning, Dr. Gardner's office.
Shirley Nielsen has worked in the medical field for 30 years, which means that sometimes she's aware of new medical advances before the rest of the population.
Having had a strong family history of breast cancer with my mother and her 3 sisters, and also a young niece having had breast cancer, I'm very conscientious about keeping up with my own breast health.
Shirley had the chance to be one of the first patients to try out a new automated 3-dimensional breast ultrasound machine.
The difference between a 2-dimensional ultrasound, the transducer is approximately 4 centimeters in length, where the 3-dimensional ultrasound, the transducer is 14 centimeters. So it's covering a wider amount of tissue. The 3D ultrasound images the entire breast, so it's getting all the breast tissue and nothing is being missed. This way, the radiologist has the entire image to look at. If there's anything of concern that needs to be addressed, then we schedule the patients for a targeted 2D ultrasound and aspirate or do a biopsy of the areas of concern.
Dr. Ileana Alvarez, a pathologist and a diagnostic radiologist, explained that 3D ultrasound has certain advantages.
First, you have a large field of view. The acquisition process is a second great advantage, in which you can actually image in a 3D ultrasound fashion the entire breast.
For Shirley, having the 3D ultrasound was reassuring because it gave doctors an image of the entire breast, not just part of it.
I like to think that I'm giving myself every advantage by having new tests when they come out.
Kelly Dunn, WPTV News Channel 5.